Mesothelioma is an aggressive form of cancer that develops from the mesothelium, which is a protective lining that covers most of the body's internal organs. It is usually caused by exposure to asbestos. The mesothelium protects and lubricates vital organs like the lungs, pleural mesothelioma, abdomen, peritoneal mesothelioma, and heart, pericardial mesothelioma. The symptoms of mesothelioma often do not appear until 10 to 50 years after exposure to asbestos. Some of the most common symptoms include chest pain. This is one of the earliest and most noticeable symptoms, as the growing tumor can put pressure on the chest wall and lungs. The pain may worsen with deep breathing or coughing. Shortness of breath. As the tumor increases in size, it may press on the lungs and cause difficulty breathing. This symptom tends to gradually worsen over time. Fatigue. Difficulty breathing efficiently can make even light physical activity exhausting. Fatigue associated with mesothelioma often does not improve with rest. Weight loss. The tumor and difficulty breathing use up extra calories and nutrients, so unintentional weight loss is common with this cancer. Cough. A chronic, dry cough may occur with pleural mesothelioma as the lung is irritated. The cough may produce blood in later stages. Abdominal pain or swelling. With peritoneal mesothelioma, the tumor may cause pain, bloating, or swelling in the abdominal area as it spreads. Fevers. Fever occurs in some patients, possibly related to infections developing due to reduced lung capacity. Night sweats. Excessive sweating, especially at night, is a potential sign that the cancer may have progressed. Lumps near the chest wall. In later stages, visible lumps or bumps may appear under the skin of the chest wall as the cancer grows outward. If mesothelioma is suspected based on symptoms and asbestos exposure history, doctors will use chest X-rays, CT scans, and MRI images to look for abnormal thickening of the linings or tumors. A biopsy of suspected tissues under microscopic examination is usually required for a conclusive diagnosis. Staging helps determine how advanced the cancer is. Treatment options depend on the location of the cancer, staging, and a person's overall health. The main goals are to relieve symptoms, extend survival, and potentially cure cancer if discovered early enough. Treatment may involve surgery, to remove part of the lining or entire lung in some cases. This offers the best chance of cure if the tumor is localized and completely removable. However, mesothelioma often grows in multiple places that can't be fully removed. Chemotherapy. Drugs like pemetrexed and cisplatin given intravenously to slow tumor growth. Combination chemo may extend survival for up to 18 months on average. Side effects can include fatigue, nausea, vomiting, low blood cell counts, and sores in the mouth. Radiation therapy. High-energy rays are used to shrink tumors and relieve symptoms, but they do not cure mesothelioma. Radiation is usually given with chemotherapy or after surgery to destroy any remaining cancer cells. Short-term side effects are similar to chemotherapy. Pleurodesis. For pleural effusions, a procedure is done to glue the linings of the chest wall and lung together to prevent future fluid buildup. Chemicals, such as talc, are often used for this. Photodynamic therapy. A light-activated drug is infused and then activated by a laser to damage cancer cells. This can help relieve pain from chest wall nodules. Targeted drug therapy. Drugs that block specific pathways essential for cancer growth, like bevacizumab and rucaparib, are showing promise in clinical trials when added to chemo. Fewer side effects than standard chemo. Palliative care focuses on relieving symptoms, pain management, nutritional support, and other services to improve quality of life for those who aren't candidates for aggressive treatments. The overall prognosis for mesothelioma remains poor due to late diagnosis, aggressive growth patterns, and limited treatment options. However, outcomes have been gradually improving with earlier detection and multimodality treatments combining chemotherapy, radiation, and surgery. Ongoing clinical trials continue exploring new anti-cancer agents and immunotherapy approaches. With proper treatment, some patients now achieve long-term remission or cure, but the average survival time remains 12 to 21 months.